Hello, YouTube. This is day one after trigger finger surgery, and I wanted to share my views with the people about it. So, how this all started is I rehabbed my one of my bathrooms, and I must have done at least 100, 150 hand cuts, porcelain tile, pressing down and scoring line, snapping. And obviously it's sort of repetitive motion injury from doing that. And I had developed a trigger finger in my right index finger. So, I dealt with it for a while to see if it was going to, resolve itself. Of course, it didn't. Uh, so maybe after about a month, I said, okay, I got to do something about this. Now, I had a friend that have had the trigger finger surgery, so it was a quick, simple process, and within a couple of weeks, he was in great shape. They took stitches out of after a week. In 2 weeks, his hand was functional. wasn't perfect, but was functional, and it got better gradually. And he's a much older gentleman than myself, so that's what I was thinking. I'll just go ahead and just get the surgery. Of course, the doctors give you options and tell you that you don't have to run to surgery first. You can try the steroid injections and see if that works. So I said, what the hell? I said, you should always at least give one attempt before you do a surgical procedure, if you can avoid it. So I had them do the steroid injection, and they did that. And it took maybe 2 weeks before it actually started working. After 2 weeks, the finger was moving without getting caught up. And I said, okay, great, excellent, worked out. So of course, that's not going to stop me from working. I wasn't abusing the finger after that or anything like that, but I was, back doing whatever I do on a normal basis. And a lot of work, not something very strenuous. I wasn't cutting tiles again or anything like that. And I think maybe it lasted about a month, and then it came back again. The funny thing is, during the day when I was moving, it was little no problem. It was a little stiff, the joint there, but it wasn't triggering. And it's something I probably could have dealt with and wait to see if it resolved itself again. But at night, it would stiffen up and start triggering again, and it was, starting to hamper my sleeping. So I ran again, and I said, okay, let me go check it out again. And once again, they said, you can have as much as three injections. Sometimes it works for people a second time. So I let the doctor convince me. When I can't say the doctor convinced me, the doctor gave me good advice, and I decided to take it to go ahead and take another shot. And just like the first one, it took 2, 3 weeks, before it would work. I had to suffer for another 3 weeks before it worked. And then when it worked, it lasted another month, and after a month, it was back again. I said, "Okay, I'm not definitely not doing any third or anything like that because not only was it coming back, but I was feeling like the joint was getting stiffer. Like the injections were actually doing some sort of harm also." So I went back to the doctor, hand specialist, and I said, "Okay, no, let's just go ahead and let's get this thing done." Schedule an appointment. Uh, Doctor was getting ready to go on vacation. I had to fight with her to make her squeeze me in before she went on a vacation. I didn't want to wait any longer, but it was still scheduled for another week and a half, I think it was. So we go in, and of course, first of all, they said you have to be pre-cleared by your general practitioner. Now, the funny thing is, or ironic thing is, I just went in for a part of what I thought was my annual physical, which turned out to be, oh no, it was a follow up on your cholesterol, which they had drawn blood and gave me, a full physical since I was seeing the doctor. So I said, okay, I just a week ago or 2 weeks ago, I just gotten blood work. Oh well, they don't take the same type of blood work. They don't, make the same tests. So you still have to go back for blood work to be pre-cleared. Okay, so I had to go back to my doctor, get more blood work, and get him to pre-clear me for surgery. Now of course, you have to be scheduled for EKG, then you have to get a chest X-ray. A pile of stuff you have to do before they'll clear you to get any surgery, even the uh, smaller procedure like this. Okay, which I understand. I mean, I guess if you're gonna go on the anesthesiology, they want to make sure anesthesia. They want to make sure that you don't have no underlining problems that's gonna trigger a bad response, and then all of a sudden they're responsible for it. Okay, great. But I said, of course I research this online. Why do I have to be under anesthesia? Why can't we just do a local and get it done? But like many doctors out there, they have their own ideas on what they want to do and how they want to do it. And this particular doctor preferred, the anesthesia. And they said it was going to be a twilight where I'm not going to be completely out because they need me to, flex my hand afterwards to see how things are working. So I said, okay, well, that's what the doctor's comfortable with. That's what we're going to have to do. So now I get all pre-cleared for everything. I set for surgery, and then the waiting is the worst part because I'm still suffering at night, not sleeping well because the trigger's worse at night and than during the day. The more they have to come in for surgery, as you're going to see many other YouTubers have placed online, you have to be prepared to be interrogated. I mean, real interrogation. When I say interrogation, I mean they ask you some basic questions at one point, and then you're gonna be asked those same basic questions and by 4 or 5 different people, and I do mean 4 or 5 different people. Yeah, be asked that by the receptionist. All those questions are gonna be asked again by the nurses when you go in there. Then you're going to be asked again by the anesthesiologist when you get inside there. Then you're going to be asked again by, somebody else. It just keeps going, the same questions, and I guess these are sort of redundant measures to make sure everything is correct, So we go through that, and you got to be prepared for that. Now, the surgery takes a short period of time. When they finally wheeled me into the operating room and started the sedation, which they said was going to be this twilight. I mean, I didn't even feel myself going out. You just disappear, and you don't have any concept of when you went out. And when I got back, I was in recovery. So obviously, I don't know if they changed their mind or the anesthesiologist gave me a little more than he expected to give me, but there was no twilight. I was out like a light, and there was no point where they were telling me to move my hand or anything like that. I was in recovery, unless I was in such a twilight stage that I don't remember any of that stuff, but I doubt that. So afterwards, they bandaged it up as it is, as you see, and it's pretty tight. This is, like I said, the day after I had it done yesterday. And your hand's completely numb. It was no problem. They did give me a prescription for pain medications, which I never take, and not a matter of being some macho man or something like that. The fact is that they never work for me. I mean, I've had this oxycodone and all sorts of these powerful stuff that everybody seems to want to love, the people who get addicted to it or drug addicts or whatever not. And I've tried that in past operations, and it just got me sick. It didn't stop the pain; it got me sick. I don't see any good reasons to take it. Maybe that's just my makeup, and maybe it's a good thing. That I don't respond well to drugs. It doesn't make me feel good. So I said, okay. As I had the Achilles tendon full operation and had no drugs after that, and it was painful, but bearable, no problem. I'm not going to get any pain medications. And worst comes worst, I could use some over-the-counter stuff. Okay, so after the anesthesia and the numbing wore off after the operation that same day, I mean, that pain was much more than I expected. And it wasn't much more in the fact that I was in such pain I had to find some drugs or do something. I didn't even take any aspirins even then. It's something I'd figure a couple of days I'd ride out. The problem was at night, it was at the point where I couldn't sleep. Oops, the television turned on, of course, by itself. Let me deal with that. First of all, let's give you a sense. So we know he's supposed to be going there to focus. I put that on pause, and then usually it's indefinite, but I guess sometimes it pops back on. Anyway, so the pain at night was really rough for sleeping, not rough for me saying, "Oh, this is so horrible. I got to get some medication." So I did take two Advils, and it brought it down to the point where I could sleep after a couple hours. I mean, the pain was still there, but it brought it down to a point where I could sleep without a big problem. About the bandage itself, online, a lot of different people have said, the doctors have said different things. And like I said, once again, it's based on doctors' preferences. I and I wanted my doctor to say what I wanted him to say based on one particular view where they say, okay, great, after 3 days you can take the bandage off, put a little surface bandage on, and continue on. Some of the reviews said that right away you're supposed to be flexing to make sure it doesn't get stiff. Pretty much all of them said that. Now, my doctor put the bandage on, and I asked them, well, when can this come off? And they said, oh, it comes off in the 10 days when you come back to see us, to get stitches out. So now it's not the 7 days like some people had said. It's a full 10 days for my doctor. Great. And, oh, keep it clean. Well, listen, I'll keep it clean as possible. I mean, I'm not working with anything like that. And this is day one. It's already a little dingy, as you can see. You're not going to be able to keep it but so clean. I can imagine, how it's going to look with general use after 10 days. And I do cover it, when I'm doing anything, when I'm in the shower and so forth. I put the rubber glove on and I tape it down and all that stuff so it doesn't get wet. But I can't see, this thing, pristine clean for 10 days. It's not going to happen. Now, I want to follow the doctor's recommendation, just keep it on and not do anything whatsoever until the 10 days. But if this just gets too cruddy, I'm going to at least take off this outer bandage and wrap it over, with the new outer bandage. I'm not going to go further into it and start looking at it and all that stuff. Big part of that factor, and probably part of the factor why they told me to just leave it on until they come in, is that they didn't recommend any antibiotics or anything. They didn't give me a prescription for that. And another friend had went in for something else recently, and they didn't give her a antibiotic prescription either. I think, in my mind, it's one of those things where maybe the doctors got new memorandums sent around to not just automatically prescribe antibiotics, because some people are abusing it or just not using it correctly and creating resistance to antibiotics or different things. So that's part of the thing, I think, is that they not automatically giving you antibiotics, and they don't want just you fooling around with it to introduce an infection. So that's probably why they want to keep the bandage on as it is. And so we'll work at that. We'll do it, the way doctor wanted it done. What's another thing I would say? Another thing, yeah, is just that there's no pre-op follow-up, as in I'm saying, come back in the next day or 2 days later just so we can take a peek at it or something like that, which I thought was a little unusual. But, these guys are professionals. So unless, of course, they give you the big spiel on if it turned black and your finger drops off in your bed, then there's a problem. You should come in or go to the emergency. That's something we didn't need to think twice about. It's still swollen there. And I was a little concerned. I figured the second day wouldn't be swollen. But the way I read in my research now is that it could be swollen for weeks, in some cases. They, of course, tell you to keep it elevated above your heart, and to ice it to help with the swelling, So I've been doing that a little bit also. I think I covered just about most of it. I know you're tired of looking at this hand, but it is valuable information, stuff that you're going to get from other people also. If you're going to go get surgery, and if you're not on YouTube checking the stories of 2 dozen people before you do it, you're not doing yourself a service. You can learn from it. I check YouTube for anything. I've learned how to do piles and piles of stuff there, and I just got information from different people, and you can correlate. What's probably going to be best for you. But of course, like I said, the doctor decides that. You get a doctor that you trust, and you follow their instructions, not what YouTube is telling you or anyone else's doctor is telling you. All right, day one, and I'm going to post again later on if there's any changes, such as the swelling going down and so forth, or any negative changes also, which I'm hoping that's not going to happen. If not, if everything's just working great, next post will be 10 days when the doctor takes stitches out. Hope this helped someone. Take care.